There's chapters about weaning off of psychiatric medications. There's chapters about chronic complex medical illness, particularly mold toxicity, and a condition that's a connective tissue disorder called Ehlers-Danlos syndrome, and something that's extremely common called mast cell activation disorder that very frequently is mistaken for psychiatric conditions. All of those conditions, people have experiences of depression and anxiety and brain fog and insomnia. And so they're sent to see a psychiatrist. And if a psychiatrist doesn't appreciate the underlying physical causes of this, they can just be prescribed antidepressants, which is not what they need. They need to, treat their mast cell activation, which can be quite treatable.
This is Spirit Gym. In today's episode, our host, Paul Chek, is talking with award-winning author and board-certified adult and child psychiatrist and psychoanalyst, Judy Tsafrir, MD. The topic of today's conversation is holistic psychiatry. This podcast would not be possible without you, our listeners, and also our premier sponsors, Bioptimizers, Paleo Valley, Wild Pastures, and Organifi. Keep listening to this episode for special offers and discounts from our sponsors, or visit the show notes page at paulchek.com/podcast.
Hello, everybody. Today we're going to talk about holistic psychiatry with holistic psychiatrist Judy Tsafrir. I was pleasured to be able to listen to Judy speaking with Jeffrey Mishlove on his new Thinking Aloud channel on YouTube. And my reaction early in the interview with Jeffrey was, I've got to get Judy on the show. And she was kind enough to come join us. So Judy, welcome.
Thank you so much, Paul, for having me. I'm looking forward to talking together.
Yes, thank you. I was really amazed by your background and your transition from the more traditional Western approach to psychiatry. To begin, I'd love it if you'd share your story with people so they can kind of get a sense of who you are and why you've made the transition and what drew you to things like shamanism and art and the other things that you incorporate today.
Boy, oh boy, Paul, that is like a huge question. I mean, just as with most people, things go back to the family and to childhood. My father was also a psychiatrist and a psychoanalyst.
Oh, wow.
And he was also very interested in astrology.
Neat.
But he, because of fear for his reputation, he was very much in the closet about that. But it was something that I grew up with in terms of there were magazines about astrology like Dell Horoscope, which was something that existed in the 60s around the house. And he would talk about like eclipses. He had a very different orientation towards astrology than the one that I have. He had a more kind of predictive, sort of old-fashioned approach to it. But I went with him to see mediums and other kinds of spiritual healers. So all of this was like in my vocabulary from the family growing up. In his mind, there was nothing that one could do that would be more laudable than being a psychiatrist and particularly a psychoanalyst. He was a difficult person and a difficult person to be close to. I think I responded to that by kind of being like him in certain ways, identified with him, at least professionally. I became trained as a psychiatrist and a psychoanalyst. I was never a conventional psychiatrist insofar as I was never a psychopharmacologist, which is the role that most psychiatrists play today, because most psychiatrists are not trained in depth psychology. They're not psychoanalysts. But for probably 25 years, almost 20 to 25 years, I had a private practice that was mostly psychoanalysis and psychotherapy. When I was 49, at a time of an astrological event that is called the Chiron return, which is it happens, as I said, when a person is 49 years old. And at that time, there's a big impetus to address some kind of way in which we are essentially wounded and also to spiritualize the life. And so at that time, both my parents died within 3 months of one another, and my marriage ended, and I had 3 young children. And so I consulted a professional astrologer for the first time, and I was just so fascinated by what she had to say to me and how she could understand me by looking at my horoscope that I returned to see her multiple times to look at the astrology of my children and of various family members. And eventually resolved that I wanted to learn to be an astrologer myself. And that was the beginning. So I apprenticed myself to a very well-known astrologer, Stephen Forrest. And then I had a second excellent astrology teacher, Maurice Fernandez. And that was sort of the gateway. And it opened me up to exploring many different kinds of healings, including shamanism and energy medicine, and also functional medicine. So, physical, looking for root causes of illness in the body that can be addressed rather than simply suppressing symptoms with pharmaceuticals. And since that time, over time, I've just been collecting different kinds of skills and studying different things, and my practice has morphed over time. I'm always adding new modalities. The most recent one, which I trained in a year ago, was ketamine-assisted psychotherapy, and I've been having very remarkable experiences with that in my practice.
Where does the shamanism fit in? I know you talked a bit about that with Jeffrey Mishlove, and I see your picture of the white lion behind you. So it seems to me that your own soul's compass has probably reconnected you to things that maybe are part of past lives, is what I sense intuitively. How does the shamanic aspect of it fit into your own life, and how does that affect your work as a doctor?
Right. So I think in the most fundamental way that it affects me is in my personal life, because I take a shamanic approach to my life. I'm always asking for help and guidance from the spirits. Very often before I start seeing patients, I think about each of them, who I'm going to be seeing, and ask for help and guidance with them. And in my day-to-day life, I am very aware of the consciousness that exists in animals and in plants and in my garden. And I'm aware of making offerings to give thanks and to ask for blessing and to give blessings. So it's very much like a part of my daily life. And in terms of how it comes into my practice, well, in my book, in the chapter that's called Reclaiming a Multidimensional Sense of the Self, there's a whole list of practices. Many of them are shamanic, which I talk about with my patients, because many people are longing to have a richer connection with their soul, to have a sense of the spiritual in their life, of feeling connected to something greater than themselves, but they have no idea how to go about it. So I will talk with patients about prayer, about asking for guidance, about gratitude, about acts of service, of increasing the amount of beauty and goodness in the world through tangible deeds, in terms of fundamentally spiritualizing their lives. But in terms of doing shamanic rituals, I so far have reserved that for when I'm doing the psychedelic work with patients with the ketamine, doing it in a sacred and ceremonial way, and calling in the directions and the ancestors and the guides, formally with a drum, and asking my patient who they would like to have accompany us and assist us on the journey, using smudging and setting up an altar. So in that aspect of my practice, I'm physically using shamanic tools.
I think that's very important. And I think personally, I've been trained in and practiced and used plant medicines and healing work for, I don't even know how many years now. I started in 2006, probably conducted approximately 1,000 healing ceremonies in my own research and work with plant medicines. And as the plant medicine, particularly psilocybin, it was LSD, as you know, but now psilocybin it's at risk of becoming pills that anyone can get.
Exactly.
I'm worried about the loss of the sacredness of it.
Absolutely, 100%. I've got some kind of, I get these medical newsletters, and they were talking about developing some kind of LSD drug that was going to be used for anxiety. And one of the side effects that they were trying to get rid of were the psychedelic effects of it.
What's the point then?
Yes. But, they just want the anti-anxiety suppression without any kind of transcendent experience.
Yeah, it's materialistic. science.
Yeah, it's scientific materialism.
Yeah, it's bad news. What's even, I've studied the history of medicine, and what's pretty sad is a huge percentage of the drug formulations were actually stolen from native tribes and shaman and medicine men, and then patented. And then, they would go in and trounce the jungles, and none of these people get a penny for teaching them and all this. It's sort of it's kind of like a mirror image of what's going on in the
totally just kind of this exploitation.
Another thing too that I know from plenty of my own research, for example, there's ways you can extract LSD naturally.
From grain?
Yeah, you can do it from the grain and let it mold. And a friend of mine has the skills to do it, so I have some exposure to that. And then if you've got mescaline, which you can get from San Pedro cactus versus mescaline pills, and you've got psilocybin from the mushrooms versus the pill. Point I'm driving at is, having experimented with these myself, I think that there's a lot being taken out because, for example, if you take the mushroom itself, there's a huge cacophony of synergistic molecules or chemicals in there.
It's a whole food.
It is, and it's also,
it's not just like a distilled, essential, one thing. It's
not a drug. It's a medicine.
Right.
And so the thing I'm pointing to from a spiritual perspective is that this, I don't want to get too wild and deep to try to fit it into a short sentence, but if you think of the DNA as a cosmic antenna, and it's tapping into the morphic field of that being, we'll call it the oversoul of the mushroom, the chemicals that are in there create a resonant vibration that I think goes into sympathetic resonance with the soul of that plant being, in this case, the mushroom oversoul. But once you start extracting to all you have is psilocybin, it's as though, if you can imagine an antenna like you see on the roof of a house. It's got arms on it. It's got parts to it, because those things have to do with the frequency of the wave that it's capturing. If you start knocking chunks of the antenna off till all you've got is a straight tube, you might still pick up some signal, but you don't have what it was designed to do. So you maybe lost 50% of the channels you could receive or something like that. From my own inner explorations and my knowledge of antenna systems and subtle energies, etc., I look at this and I think, you're actually knocking out a lot of the spiritual healing capacities by isolating one molecule, because you're destroying the link to the spirit that channels through the DNA and the chemical structure of the plant, which the chemical structure to me is not just a chemical structure, because if you look at sonic geometry, all those chemicals produce frequencies which produce geometrical forms which have resonance. So you're knocking out the resonant field, and therefore you're losing the ability that it gives your body to tap into. And I think it activates the genes that used to be called junk DNA in us to access that aspect of the evolutionary history of species, which I think the junk DNA personally is the evolutionary history of species, which is why a shaman or people like you and I can talk to trees and plants and stones, because those frequencies are all built into us because we have our history inside of us. My only point that I'm trying to encapsulate here is that I think that they're taking the soul out of the medicine.
Yeah, totally. I'm completely with you. And I think it's just misguided and not surprising.
No. And unfortunately, what it can lead to is if as this goes on, it leads people to developing a belief that medicine may or may not be useful to them, but they don't realize that they've actually never really experienced the medicine. So hopefully this is one of the reasons I like talking to people like you, so we can educate people that, if you really want to get help, remember the Hippocratic Oath, first do no harm. So go for what's the most natural to life and the most natural to the body. In other words, the mushroom or the cactus versus the pill, and find someone that's skilled enough to conduct a sacred healing ceremony as opposed to sitting in a sterile environment. Hi, everybody. I sure hope you're enjoying the podcast. You know, a couple of months ago, Organifi sent me a couple of bags of their new Shilajit gummies to sample, and I was blown away with how great they taste and how much my body loved them. Having used Shilajit paste for many years, I've never been a big fan of the taste of it, but when I tried Organifi's new Shilajit gummies, I was truly impressed. The texture and consistency of the gummies is excellent, and they have just enough natural sweetness to let me feel like I'm getting a lovely, healthy treat for both my mind and my body. Shilajit is a unique, potent mineral paste from the Himalayan mountains. It contains an abundance of trace minerals, antioxidants, organic acids, and nutrient-transporting compounds. It's been known throughout history to help boost vitality and strength. Just pop a couple gummies and chew, or suck on them slowly for a steady release of the delicious, earthly, but slightly sweet natural flavor. Your taste buds will enjoy the delicious treat while your body soaks up the massive amounts of feel-good nutrition. Rich in fulvic acid, humic acid, vitamins, enzymes, bioflavonoids, antioxidants, metabolites, and over 40 trace minerals, Shilajit gummies can help support energy production, support performance and recovery, support healthy muscles, promote collagen synthesis, support healthy hormone levels, increase cellular energy, decrease fatigue, and promote heart health. I absolutely love Organifi's Shilajit gummies and went through 2 bags in no time because my body craved them so much. I reached out to Organifi to get more right away, and I bet you will too. To get your 20% off for Living 4D listeners on your Shilajit gummies, go to Organifi, organifi.com/CHEK20. On checkout, use the promo code capital C, capital H, capital E, capital K, 20. That's Chek 20 on checkout to get your 20% discount on your awesome Shilajit gummies. I honestly love these things. I know you're going to be just amazed with how great they taste and how good they feel.
It's interesting with the ketamine because that is a chemical. It is a pharmaceutical, but the way that it's sometimes administered is IV in a sterile medical environment without any attention paid to set or setting, without any provision made for integration of the experience. And there's a way to use the ketamine, as I was describing, in a sacred and ceremonial way, and at the same time that it is a chemical, and to make sure that there's space and time made to integrate the person's experience while they're taking the medicine. Very useful, even though it is a chemical.
Yes, I've had 3 people come to me quite badly injured from going to ketamine clinics. All of them have been sad, and the cost of it. The first one that came to me, who was one of my students, paid $32,000 for, I think, 2 or 3 day process. But give you an example of what happened. He came there and his father had to drive him there. He's got an ex-motocross racer with a series of bad concussions that left him somewhat challenged. And the guy the nurse took him in, the guy put him on the drip, and then the next thing you know, he was in extremely deep. And this guy's done deep plant medicine ceremonies before, so he's not new to going real deep, but he was in very deep. And then the guy came and took the needle out of his arm and said, "Okay, it's time to go."
Right.
And it was at the end of the day,
traumatizing.
He said to the guy, he says, I'm still deep in this ceremony. I can barely walk. He says, I'm having a hard time even talking to you. Well, the guy says, well, you got to leave now because I've got to go home. And the guy had him crawl out on his hands and knees to the waiting room. He couldn't drive. He had to call his dad. He could barely talk. The girl that worked there had to wait till his dad could get there to pick him up. Well, this whole thing went down and they did 2 days of this, 2 or 3 days of it. And by the time he got finished with it all, he was completely scrambled, had to come see me and spend 3 days with me.
Well, it's just like way too much, way too fast, no integration.
Yeah.
The whole, when I did my ketamine training, they described it as like WD-40. It kind of loosened things so that a person has the possibility of thinking about things in a different way. But if you do too much, too fast, it just gets scrambled, like you said.
Yeah, I think he described more of it being like a death experience to him. It seems to me they gave him quite a high dose. I had to do a lot of integration work on him. He was quite scrambled. But the point is, this is the difference between someone with your background that knows how to keep things sacred and run these healing ceremonies, if you will, so that they actually have healing qualities and a healing environment and a healing consciousness, as opposed to, ketamine or any of these drugs being used like you pull your car over at a quick oil change place and you just jump in there and off you go. I mean, that's completely against all the teachings from all the natives throughout history, As psychiatrists, Carl Jung, Edward Edinger, and others, for example, Stanislav Grof, which I'm sure you're familiar with, gave psychology a much stronger soul-centered perspective. Steiner-oriented psychiatrists Rudolf Streicher and Bernard Livegood's books have helped me understand soul phases and soul development and unique perspectives on illnesses and the soul. Dr. Dan Siegel's books on the mind, I think, are very good for modern psychiatry. I'd love to hear your perspective regarding how it is that we have such incredibly good influences from psychiatrists like I've mentioned and people like yourself, yet psychiatry seems to have lost its soul. What do you think's happening and what happened?
Well, I think it's the same thing happening in psychiatry that's happened in all of medicine. Kind of reflects the scientific materialistic paradigm in our culture. And it reflects the power of the pharmaceutical lobby. There's a paradigm that in both medicine and psychiatry that the way that you work is that you see a patient and hear from them and identify symptoms that they're having. And then on the basis of those symptoms, you decide what is their diagnosis. And on the basis of that, you prescribe a pharmaceutical that's meant to suppress the symptoms, or, it can be like a procedure, like surgery that is also meant to get rid of symptoms. But it's nothing about soul growth or about a person's healing in terms of helping them realign with their life purpose or what they're meant to do here in this incarnation. That's completely not part of the vocabulary. And even there's like an allergy to the sacred.
Oh my God, that's terribly true.
It is.
It's sad.
It is, but it's like follow the money. And when you hear about like the healthcare costs in the United States versus in other countries, developed first world countries in the world, and when you compare outcomes, we're doing terribly. The corporations are really enriching themselves.
It's getting worse and worse. And you got to wonder, how far can this go, before people finally wake up to the fact that it's not even worth going to doctors unless you're in a car accident. I think the orthopedic surgery aspects of it are still quite good and in many ways improving.
Right. Trauma surgery, unparalleled. Like if a person is having like a medical crisis, like they're septic, in shock, that's to stabilize the organism emergently, or, things like cataract surgery, fantastic. But anything that's like any kind of chronic condition, many of which are caused by our diet and our lifestyle, the treatment algorithms that doctors are obliged to follow or else risk being not reimbursed by the insurance company, do nothing to help those conditions. It's just trying to suppress symptoms, and the health just further erodes.
It's shocking to me because, think about it. If you owned an insurance company, the worse your patients do, the more money you pay. You would wonder why the insurance companies are not stepping in to do a very, very careful analysis of which therapies work and which doctors. Like if I owned an insurance company and I had you in my subscription, in other words, I covered your patients or I sent you patients from my carrier, I know I used to own a physical therapy clinic, and they were tracking how long it took you to get somebody over and discharged from any given diagnosis. And I'd actually had conversations with charge nurses working for the insurance company, And one of them said to me one day, she goes, "Oh, we've observed that the average lumbar disc patient only needs to see you 6 times before discharge. You realize that's like way faster than anybody else. How is it that you're doing that?" And so I had a conversation and I invited them to come to my physical therapy clinic to show them how it is. And I told them most of my work is education based. It doesn't matter what I do in the clinic. If I don't send someone home knowing how to manage an acute disc injury, they're never going to get better. And they're going to, even if they have surgery, they'll just have another problem. And so you see, the point I'm making is that the insurance companies are spending massive amounts of money and it's getting worse. So you have to ask, why are they not getting involved and looking at what therapies and procedures and drugs are and are not working? That's confusing to me.
Yeah, I don't understand the whole way that the systems interact with one another. But I mean, somebody is making a lot of money from it.
A hell of a lot of money, dangerously high amounts of money. You know, there's an old saying, it's hard to change a man's belief system when his paycheck depends on it. And I hear man is not sex dependent. You know, it brings me a question that I want to ask you. I mean, I've been in rehabilitation for a long time. I've been a holistic health practitioner for 40 years. I've rehabilitated countless people of all sorts of problems. And I've often wondered, you know, I watch my patients. I see which doctors' procedures do well, which doctors don't do well. Of all the doctors I know that do ACL surgery, I can tell you exactly which doctors' patients rehabilitate the fastest. I've been to surgery with most all of them. I watch the way they do surgery. I see who takes shortcuts. I see who's lazy. But the point I'm driving at here is that every good doctor that I would say is a good doctor is always watching. And if their patients are not responding the way they think they should be, they always investigate. And I'm famous for the guy that you send all the people to that nobody knows what to do with. And so the doctors would be very interested in what my analysis was. And for example, oftentimes I showed that the reason people have chronic low back pain is because they have an undiagnosed atlas subluxation, malocclusion, ocular disorder, or a vestibular disorder, or a hearing pathology that's causing a top-down control system's adaptation of the spinal structure that's overloading the back, and the back on the survival totem pole is low compared to bite, ocular, visual function, vestibular function, and upper cervical function. So they'd always be amazed that I'm not even touching people's backs, but straightening these problems out right away by working on their jaw, their eyes, their ears, or their teeth, or their upper cervical spine. But the point is they're paying attention, they're asking questions. And so what I'm driving at is, how is it that you think so many psychiatrists are giving out all these drugs and they must see that these people are not actually improving, but keep doing it anyhow? How does the human spirit continue to use this automated, non-conscious, non-human-centric approach and not feel bad about it inside of themselves?
I guess they've not informed themselves about an alternative. You know, like they've just kind of bought into the paradigm and they haven't investigated what else might be helpful or how other people are approaching it that are not, you know, part of the conventional system. I mean, everything is like, in quotation marks, evidence-based, meaning, you know, there's double-blind, placebo-controlled studies that point to the efficacy of a certain pharmaceutical. And just because there's, you know, many practitioners saying that, you know, diet has an enormous impact upon a person's psycho-spiritual, emotional, mental state, you know, if there's not the studies to prove it, then just disregard it. It's the paradigm.
Yeah, the problem is there are plenty of studies to prove it. They just don't look at them.
The Chek Institute is thrilled to introduce the brand new second edition of the highly acclaimed Holistic Lifestyle Coaching Level 1 online program, also known as HLC1. HLC1 has been at the forefront of holistic health education for decades, and now the online course has been extensively revamped for a brand new learning experience. This course covers all the important essentials for adopting a healthy, holistic lifestyle using the 6 Chek Foundation principles and the 4-doctor approach developed by Paul Chek. Whether you do this for yourself, your family, or to help your clients achieve their goals, this is a personalized approach to adopting a holistic lifestyle. The course guides you through from assessing where you are now and identifying your goals and motivation to showing you the most important steps you need to take and the order to take them as you progress along the path to optimal health and well-being. Presented by key members of the Chek faculty as well as Paul himself, HLC1 is all online, so you can learn at your own pace in your own space. Enroll now in the Chek Institute's Holistic Lifestyle Coaching Level 1 online program and take the first step towards becoming the healthiest version of yourself. Go to chek.group/HLC1 to learn more and register now. That's chek.group/HLC and the number 1.
As I was listening to your interview with Jeffrey Mishlove, you're explaining to Jeffrey how you give talks, or you offer to give talks at Harvard, was it?
Well, it was at the Boston Psychoanalytic.
And how you were saying they kind of just ignore you.
Yeah.
And there's the problem.
I didn't persist. I didn't, when they ignored my email, I didn't write again and again. But I do think that there's just, like I said, some kind of allergy. It's just, it doesn't fit the paradigm. They don't want any part of it. They are simply focused upon the personality self, and it's threatening. And the response to it is to be denigrating of it.
You mean if you respond to that?
To be, contemptuous, let's say, of astrology, because
right, yes.
Not knowing really much about it, but they're just wedded to their view of reality.
Yeah. Wow. Well, it gives us more people to pray for, doesn't it? Well, I mean, what else can we do? I mean, short of being a Bill Gates and doing a forced holistic reform, which won't work because then we're going against the principles of spiritual practice. But I think the thing we can do about it is what we're doing right now. And that's why I wanted to talk to you, is I wanted to let people know there are people out there like you, not a lot of them, but they can find you now and at least know that occasionally Great Spirit brings an enlightened soul up out of the dark.
Well, I think there's just increasing interest in, alternative methodologies and energy work, homeopathy. I mean, medicine is conventional medicine is incredibly slow to change. But I mean, patients are seeking out practitioners, because they're not feeling at all satisfied with the conventional care that they're receiving.
Yes. Have you ever read the book? I think it's called The Body is Your Subconscious Mind by Candace Pert.
Yes, I know. The Molecules of Emotion.
Yeah, the molecules. There's that one. And she wrote The Body is Your Subconscious Mind as well, I believe. But, she's the inventor of the SSRI drugs. Did you know that?
No, I didn't.
Yeah. Well, it's not very well talked about, but she told them when she was doing the research that she did not think this was a safe drug to use. Even though she identified the SSRI pathways and everything involved, her research said that she didn't think that it's something that should be used, but they ignored her and did it anyhow. And so in one or two of the interviews I've listened to her, read with her, she talked about how she had to carry the pain of that for the rest of her life because she realized what these drugs were doing to people, but she told them her research said not to use it, but they ignored her. And that's kind of the sad reality that some of these researchers have to face. What do you consider to be the main schools of thought and practice in psychiatry today? And what are the pros and cons of each of them from your perspective?
Well, I don't know if there's so many, it seems like there's one kind of monolithic one, which is, I don't know what it's called, but evidence-based, what we've talked about, symptom identification, diagnosis, creation, and suppression with pharmaceuticals. I mean, that seems like the dominant paradigm by far. I mean, now around the edges, there's all kinds of interest in psychedelic research and recognition that, it has extremely beneficial potential for treating trauma. So there's a big burgeoning interest in that. I mean, in general, and I don't know if this is really psychiatry, but So if we just take, say, psychology in general, I mean, there's increased understanding about trauma being like a body-based kind of phenomena, and that there are treatments that address the limbic system and rehabilitation of the limbic system and sort of tonification of the vagus nerve that is extremely helpful in treating psychiatric symptoms. But I don't know if that's really like that mainstream. I mean, I think psychologists are more talking about that than psychiatrists.
Yeah, it's interesting to watch how all these things branch out, and it's like watching a garden do its own thing, where you see these different offshoots come out in all fields, really. A while back, I learned that Klaus Schwab, Yuval Noah Harari, and other key players in the World Economic Forum were big proponents of Alfred Adler's psychology. It turns out Adler is somewhat of a guru to them. This shined a bright light on their soulless conceptions and total behavioral control ideology. From my own research, very advanced mind technologies being used in social media platforms, video games, and even movies. We can see the radical telling statistics in all aspects of mental health worldwide that a combination of Adlerian mindset and disregard for the sovereignty and sanctity of the human mind is a very dangerous combination, with even more devastating consequences if we don't find the balance between these destructive forces within the human psyche. I'm just curious what your thoughts are. I know you mentioned to me in an email that you weren't really too hip on Adler's approach to psychology, but any thoughts or feelings you'd like to share in regard to the whole WEF's concept that God's not necessary, the soul is an illusion, and these kinds of concepts, and also just this sort of concept that humans are just machines and robots, that we can take them over, and that kind of psychology. What do you think the outcome of that's going to be?
Well, I mean, I think we see the outcome already. It's like happening, that's the sort of prevailing paradigm. And there's tremendous, sense of loneliness and alienation and, huge rates of suicide and depression and anxiety and addiction. I mean, that's sort of the consequence of not having a sense of oneself as a spiritual being connected to other spiritual beings, connected to nature, with a soul that one needs to nourish and feed. Like that is like a prescription for kind of deep unhappiness.
What do you think drives people to want to perceive the world and human beings in this way? Because Adler was one of the guys that promoted the idea that animals didn't have their own thoughts and feelings, that they were biological robots. And this spawned this sort of comfort with cutting open animals and using them for research and detaching from any emotional connection to the consequence of the fact that if they were living beings and they do have their own personalities and their own sentience and that they are conscious, then we would really have to consider how badly we're torturing these beings or creatures. Of course, I was raised on a farm and my mother's a yogi and I spent time with monks. So I've been raised in a way that to cut that part of me out so that I could see what it would be like to live like a Klaus Schwab or a Yuval Noah Harari. I would feel as though you were turning me into some kind of a Frankenstein or something that wasn't even human anymore. It's hard for me to imagine what it is that shapes people who ultimately not only live their lives in such a dangerously materialistic experience and conception, but get somehow enough money and power to try to inflict this ideology across the whole globe. I'm just curious, if you're analyzing such beings as a psychiatrist, do you have any tips for us on why we might want to have empathy for these people? In other words, if they were your fictitious patient, what would you suspect are the formative forces that lead to this kind of behavior?
It's what is the right thing to do, is to have compassion for all beings, so they're not excluded from that. But, like we see various leaders whose behavior is so fear-based. And when you learn about the biographies of these people, there's so much trauma in the family and so much like narcissistic injury. And they're terribly, terribly afraid and totally focused upon power and totally focused upon some kind of image that they're fantasizing that they wish to project. There's just like one example after another of these people. And they're very limited, immature, emotionally immature people.
Yeah, it's sad. It's always been a bit of a paradox to me how an individual with that profile can actually navigate social circles, social networks, university education, and somehow still manage to reach positions of such financial power and still maintain connections with people to get these mass movements created without somehow imploding, because like attracts like. So, Bill Gates hangs out with people like Bill Gates. Doctors spend time with doctors. Nurses spend time with nurses. Shaman know shaman. I'm curious as to how they've managed to get to this level of power and control over people without imploding from within. Does that make sense?
Yeah. I mean, let's take, someone like Donald Trump. Like he couldn't be successful in the way that he's successful if he wasn't tapping into, something that exists in the people who adore him.
Yes, that's true.
That he's somehow fulfilling particular need.
Yeah, it's God loves a good mystery. I can tell you that. I mean, you gotta, when you look at the world.
Well, we got a real good one going on, right?
Yeah.
Very mysterious.
Yeah. A little story here. One time Yogananda was giving a lecture in a large audience, and the monks told me about this, and it's written up in some of the books that are about Yogananda. But he was giving a lecture, and some man got really upset, stood up and raised his hand and sort of butted in and said, "How can you say that God is love when people are getting murdered all the time and kids are dying of diseases?" And he just went on his rant and his rave. And Yogananda sat there quietly for a minute, and he said, "Sir, do you like movies?" And the man said, "Yes." He said, "Do you like a little shoot 'em up now and then?" And the man said, "Yes." He goes, "How about some steamy sex now and then?" And the man said, "Yes." He goes, "How about a plot twist?" And the man said, "Yes." And Yogananda paused again, and he said, "So does God." So it was quite an answer from a monk.
What I thought you were going to say was that it's all very mysterious.
It is a
the
mystery,
way the world is. Like every morning I say, I bow to the great beauty and mystery.
Yeah, it's there.
It's just accepting that with our limited consciousness, the world doesn't make sense the way it is.
Yeah. And I think too, personally, because issues of God have been my biggest question, because as a therapist, I've run into issues of God at the root of a lot of disease. I would say most of it, actually, when I get right down to it.
Hi, everybody. I hope you're enjoying the show. People worldwide are not only finding it hard to find organic and free-range, regeneratively farmed animal foods, but as you surely know, it's almost impossible to find anything worth eating in stores, airports, gas stations, or even in the stores that should have real food. Additionally, most children are sent to school to eat microwave-processed, chemically raised, and chemically laden garbage from school cafeterias or out of their lunchbox, simply because most parents just aren't aware of the dangers of commercial food. But the truth is, there are no shortcuts to health and wellness. Unless, of course, you let Paleo Valley do the work for you. Autumn Smith, founder of Paleo Valley, is not only a mother who understands the importance of feeding children wholesome, clean foods, but is a holistic nutritionist who pours her soul into all Paleo Valley products, and Paleo Valley's meat sticks are made from regeneratively farmed animals that are raised with the highest possible standards of care. Paleo Valley's meat sticks are also fermented, which significantly enhances the nutritional quality and flavor of them. My family and I love them and carry them everywhere we go, be it during rides in the car, outings, ski trips, or we put them in the kids' lunchbox and they love them. In fact, many people I know resort to them as a meal when time is tight on the road or traveling by air. I know of no better portable food or snack food anyone can eat without losing quality or satisfaction, and we love sharing them with our guests and students at our rainbow workshops. Paleo Valley's meat sticks come in beef, turkey, and pork maple bacon flavor.
To try Paleo Valley's meat sticks, including the brand new grass-fed venison sticks, and save 15% on your purchase, go to paleovalley.com/Chek15. That's paleovalley.com/CHEK15. And your 15% discount will automatically be applied when you check out. No promo code is required.
So that I want to just interrupt you. I was surprised when you said about the lower back pain, that it was all like these mechanical things, because I was imagining that there would be also some kind of psychospiritual piece to it.
Well, there is, but I was trying to keep it short. I have what's called the Chek totem pole, which took me years to develop. And at the very top of it is the psyche. But the highest system in the body from a physiological perspective is the breathing mechanism of the body. So the totem pole is oriented based on survival responses that are wired into our nervous system. And so just to give you a simple example, at the very top being breathing, anything that disrupts your ability to breathe will cause all systems below it to compensate to try to support the breathing mechanism, because oxygen's the most essential nutrient for survival, and it's the one thing you'll last the shortest amount of time in the absence of. You can go without food a lot longer. You can go without water a lot longer. You can have a broken leg and survive a lot longer. So all the nervous system's wired. So anything that affects the breathing mechanism, if it means that you got to put yourself in a scoliosis or tip your head sideways or move your head forward, every system that gets stressed by that gets sacrificed, because the breathing system has total control to survive.
Is that just structural things? Or are you saying all illness?
No, I'm simply saying that's the physiological response. So that could be an increase in adrenaline or cortisol if that's necessary. It can be a change in structure. So I'm looking at survival reflexes, both in the structure and in modulation of the autonomic nervous system, and even instinctual behaviors. But above that is the psyche. So because we can actually choose to stop breathing by killing ourselves, it shows you that the psyche can override all internal physiological systems, all neurological systems, all genetic systems can be overridden at the level of the psyche. So I was just trying to keep it simple earlier and making the point that looking at back pain is often looking at a symptom that could be coming from many other control systems, and I named a few of them. If for anyone that wants to look at that, if you go on my YouTube channel or on YouTube and just search Chek, CHEK totem pole, there's a couple of videos explaining how all these systems work. And I designed that to show all my students the order in which you have to do an evaluation in order to actually get to the root cause of the problem. As I started working more and more with very, very complicated patients, I inevitably had to do a very comprehensive analysis of their narrative, their life story, their traumas. And I found very, very consistently that it was some kind of a belief about what God wants, or a commandment, or a misinterpretation of a scripture. A very simple example is I've had many people with chronic illnesses, diseases, and even things like back pain is very common, because they've been married for 35 years, but they haven't been happy. And I can give you a classic example. I had a guy that had chronic low back pain. He was a very, very, very wealthy man, multi-millionaire, owned his own investment corporation. And he came to me, and the doctors said, we don't know what the hell to do with this guy. He had a medical file about 2 inches thick. It probably took me 2 weeks to read through it all. They'd seen everybody from the Mayo Clinic, you name it. And when I did an orthopedic assessment on him, I could not find anything wrong. And he was actually in very good physical condition. He was probably about 56 years of age at the time. And so when I began investigating what was going on in his life, I found out that he was unhappily married. And he had been married for 35 years. He had 3 kids. And I said, well, why, knowing that you're not happy, she obviously must not be happy if you're not happy. I said, how long has it been since you were unhappy in the marriage? And he said, since the very beginning. I said, well, why have you stayed in the marriage? He said, because I'm a Christian and I took a vow till death do you part. And I said, well, how's that working for you? And what do you think that you're teaching your children about relationships and about marriage by emulating this kind of relationship to them all the time? And he said, well, there's nothing I can do about that. So here's where it gets interesting, Judy. I said to him, has there ever been a time in the many years that you have had back pain when you did not have any back pain? And he went quiet for a minute. His head dropped down. He said, well, to be honest with you, Paul, there was 1 year where I didn't have back pain. I said, that's very interesting. What was different that year? He said, well, I reached a breaking point with my wife and I took a year off. I rented a penthouse in Miami and I started having sex with other women. And I said, so while you were doing that, you had no back pain. I said, when did the back pain come back? He said, when I moved back with my wife. And I said, well, why did you do that? He said, I felt so guilty and I was worried that, I might not be able to deal with the consequences when I die and have to face God. And I said, so isn't this interesting that you already know what the problem is? Why do you keep spending money on all these doctors? And I ultimately said to him, there's nothing that I can do other than work with you on addressing these beliefs that you have, because they're nothing more than beliefs. And I said, if you want to really do the healing work, I'm happy to work with you. But he did not want to risk that journey, right? So he continued to spend money going from doctor to doctor. In fact, he actually asked several doctors to operate on him to see if they could make his back pain go away.
Yeah, I mean, that's a story that does not surprise me.
And I could give you 150 of them.
Right. That's why I was interested when you were just mentioning all of these mechanical things, because I heard somebody, I forget who it was, but somebody said beliefs are psychoactive. And that's so true.
Oh, hell yeah. And the other thing too, Judy, is, and I'm going to throw you a kind of a curveball, everything that you just described as a mechanical system has a spiritual correlate. Vision problems is I look for what are you not willing to look at, inner seeing. Ear problems, hearing problems, I go, let's look at what you're not willing to listen to.
Okay, so you see it metaphorically as well.
Yes. Atlas problems, your atlas provides 50% of your cervical rotation. The one vertebra complex, atlas axis, gives you 50% of the whole 7 cervical vertebra. So whenever I see an atlas problem, I say, what is it that you're not willing to look at, or it's stopping you from turning? The concept of chakras turn, relationships turn. So I see the body as an icon, and I see every part of it as a symbolic connection to the spiritual aspect of an individual. It's just I don't normally talk that way to most doctors, because then they look at me worse than they already do.
Right. I understand that. No, I think that's really interesting.
Well, what are some steps that you feel people can take for their own protection and improvement of their mental health as parents and individuals, particularly in light of the environment that we're in today? I mean, if you could just say, here's some suggestions that work pretty much across the board, could you share your thoughts in that regard?
Yeah, I'm very glad to. I mean, there's certain things that I talk with all patients about, and they're just kind of generic prescriptions that are a lot of them are just so much common sense. It matters so much to eat an anti-inflammatory diet. Mm-hmm. And if there are certain foods that your body does not tolerate, that, you may feel incredibly differently and better if you're not ingesting those foods. And that, just simple things like blessing your food and eating foods that are not sprayed with pesticides, that are devoid of life force because they were grown, so far away and flown miles. It's just very important, where you're getting your food.
Yes, very much so.
So that's just very, very basic. And it's something that people are doing multiple times a day eating. People need to move their bodies. It's just a prescription for feeling unwell to be sedentary.
It is very much so.
We need to walk. We need to be outside in nature.
Breathe
and be outside without our headphones on.
Yes.
And to pay attention to what you're seeing and hearing, and paying attention to, what's going through your mind. Those things that I mentioned before, it's actually from Angeles Arrien, who was a cultural anthropologist who went around the world
studied her extensively.
Studying different cultures. What are their common spiritual practices? Well, everybody prays. Everybody expresses gratitude. And everybody does acts of service. So like those kinds of things. I mean, this is not like a specific prescription for a particular person with a particular condition. This is just for everybody. It makes incredible difference, just as you were alluding to with the patient you mentioned with the back pain, that if we're in relationships that are toxic, that it's going to erode our well-being. It's incredibly important that the people that we are living with, that we connect with, that are important to us in our lives are affirming, and that the relationships are loving, and that we don't feel constantly criticized or stressed or traumatized by the interactions. I mean, it's very important to have a feeling of belonging, to develop, a sense of community, of finding like-minded souls. Like that's so important. When people feel lonely and isolated, it's very, very hard on the immune system. I mean, many people need this kind of limbic system retraining. They need to do practices that rehabilitate their autonomic nervous system so that they're not living in a state of constant fight or flight freeze. That there's practices that you can do that calm down your body. I think many people, I don't think anybody should be drinking alcohol except for in a ceremonial way, in a sacred way, that it just pickles you, it's just very, very bad for your health. And in general, I'm not in favor of recreational drug use. I feel like it needs to be used ceremonially and sacredly to evolve your consciousness. And just all the pharmaceuticals that people take, it's very possible to change your lifestyle and to do practices that make it so that it would be possible to wean from those medications, which very often are not necessary and which erode the health.
Yeah. Sleep, I think, is also something.
Sleep is huge.
Yeah,
huge.
I mean,
it's foundational.
It's such a powerful form of medicine. If you study the history of medicine, sleep was one of the most commonly prescribed for anything.
Yeah, I totally am in agreement with that. I mean, a person who has a good night's rest, that's when all the healing takes place, and they can really feel so much more resilient to deal with what goes on, the wear and tear and events of life if you've had a good night's rest. And when you're tired, you feel vulnerable and fragile and are prone to overreaction. It's just, sleep is foundational. So these are all things that are not just like for a specific person because of who they are. It's just for everybody. Yeah,
it's kind of like the requirements of having a human body. You have to.
Exactly. But that's not what psychiatrists talk with their patients about. It's just like, tell me about, do you have a depressed mood? How's your energy level? How's your concentration? Are you having feelings of guilt? Do you feel suicidal? Okay, you have major depression. Okay, you should be on Prozac. That's it.
Yeah. I recently wrote my chapter on sleep from my book series, so I did some research, which I had done earlier when I wrote my book, How to Eat, Move, and Be Healthy in 2000. The average college student today is only getting 4.5 hours of sleep a night, which is really, for a young person like that,
even worse.
Yeah, they're still growing and their bodies are still changing, their ego's still forming. The knock-on effects of that are pretty devastating, and I think that might be one of the reasons we have so much anxiety, suicidal thoughts, and suicide is because you take that and you consider that Dr. Batman Gilage, who wrote the book Your Body's Many Cries for Water, said that only 1% dehydration of the central nervous system can cause significant psychological disorders. And so many of these, I've had many of these young people as patients in my career, they say something quite phenomenal. I don't like water.
Right.
Well, maybe you need to try drinking better water, because to not like water is to not like breathing. Even if you don't like it, let me explain to you how your lack of drinking water is causing you a lot of these problems. And I say, do you like hanging out in doctors' and therapists' office and drugstores and riding around all day trying to fix problems that could be solved with a few glasses of water and a little bit of sleep?
Well, see, there's just like so many of the things that we're talking about are not things that doctors can do for you. Doctors can tell you about what would be practices that you could implement that would make a huge difference for yourself. But this is up to the patient. The person themselves needs to, eat differently. They need to drink water. They need to have good sleep hygiene. They need to align themselves with circadian rhythms. They need to get out and move. They need to connect with nature. They need to do spiritual practice. And this is all a great deal of work and up to the person themselves. And it's not take this pill and I'll see you again in 3 months.
You know, enzymes are one of the most important things we can use to supplement our diet. Very few people have normal levels of digestive enzymes. It's extremely common to be digestive enzyme deficient because so many people are eating cooked foods, processed foods, packaged foods, etc. The best digestive enzymes I've ever found are Masszymes by Bioptimizers. And one of the things I like about them is not only are they the most advanced technology for how they're produced, the science behind them, but I take them on an empty stomach every morning and every night as proteolytic enzymes to help clean my body. So I've got Wade here, who's the formulator of these enzymes, to tell us how do they work as digestive and proteolytic enzymes, because today I think we really need to be supplementing with high quality enzymes. So Wade, what's unique about Masszymes?
Well, one of the interesting things is undigested protein is one of the biggest contaminants that cause problem for people, whether it's in their blood or inflammatory conditions or even impairing recovery. And it's quite common amongst athletes who have high protein diets, interesting enough, who are looking to add recovery, but they're not breaking down their protein effectively. And that was my case way back in the day as a former bodybuilding champion. So we set about cultivating and developing an enzyme formulation that handled all of the amino acids in a pH range from 2 to 12, as well as providing an assortment of assistant enzymes. In other words, it doesn't just break down protein, it handles carbohydrates, it handles fats, it handles fibers, a variety of different things, and they work synergistically together to make sure that you can break down just about any food and digest it properly. Now, when you talk about the difference between enzymes, there's digestive enzymes and systemic enzymes. Systemic enzymes such as like nattokinase or serrapeptase. Well, they don't help break down digestion, but they can break down inflammation or inflammatory conditions, undigested proteins, or scarring tissue inside the body. Well, it turns out when you take Masszymes on an empty stomach, it works exactly the same way. It will go into the bloodstream and now works as a systemic enzyme, reducing inflammation, accelerating recovery times. Matt just tore his Achilles tendon and made a full recovery after surgery within a few weeks, which they expected for many months. He was taking as many as 100 a day. Now, I'm not suggesting people do that, but this was an extreme condition. And the bottom line is Masszymes is great for recovery, for cleaning up undigested proteins in the system, as well for digesting just about any meal. If this isn't the best digestive enzyme or systemic enzyme that you've ever taken, you get your money back. That's the Bioptimizer guarantee.
You can try Bioptimizer's Masszymes at bioptimizers.com/living4D and get 10% off using the code Paul10. That's bioptimizers.com/living, the number 4 and the letter D, and the code is Paul10. Plus, Bioptimizers always have great bonuses and offers when you purchase multiple bottles. So make sure you check them out at bioptimizers.com/living4D and use the promo code Paul10 for your 10% discount.
I've been an athlete, a competitive athlete, most of my life. I mean, I don't compete in athletics anymore, but I'm still very fit and very athletic in the way that I live. And I've trained countless of the best athletes in the world. So it's always been my job to be in good enough shape to actually demonstrate things to them so that they take me seriously. It's, you can't have fat people teaching professional athletes how to be fit and strong. It never works and they won't listen to you. But in my own life as an athlete, I've always had a means through the sports that I was involved in, which was mostly motocross, boxing, and kickboxing in my personal life. But they're all very good at telling you when your body's not working properly. I mean, you know right away when you're a high-level motocross racer, your body can't do things. You can't go as fast and you lose races. When you're a kickboxer, if your hip hurts, you can't use your leg properly, etc. And I've always found it fascinating to observe how far people will go into a state of total dysfunction before they actually make the connection. Staying up late at night for the last month has really caused me to have headaches, or I keep eating Oreo cookies and my skin keeps giving me all these problems and I'm constipated, but it wasn't there before I ate the Oreo cookies. In other words, it's like this common sense.
Connect the dots.
Yeah, the observation of input-output response seems to be almost non-existent. And that's why I wrote my book, How to Eat, Move, and Be Healthy. I'm like, I have to say these things over and over and over and over and over again. So why not just tell the whole world for $25 how to take care of a body? We're so disconnected. For most people, and particularly people that use their bodies, should be just innate common sense, because you'd never see an animal behave that way. I think it might be due to the distraction of the external environment being so fast now, with information transfer, phones, media, and a lot of externalization of the self. I call that when a person gets so identified as who they are in their external environment. I'm a hockey player, I'm a doctor, I'm a mechanic, I'm a teacher, I make this much money, that the soul seems to live outside of itself and they lose touch with their inner being. Maybe that might be part of the problem, is that we've reached the point where the ego perceives itself in its thinkings and its doings, but not in its being and its inner essence.
Well, yeah, I don't think it's like that societally rewarded to be in touch with yourself. Like it's more rewarded some kind of external achievement. But you would think that, the external achievement is eroded by like a sense of not having a sense of physical well-being. Food is engineered to make people eat things that is not healthful. There's like food chemists that have studied about how do you create, foods that people, will overeat and eat that are not healthy because they, are so sweet or so salty or there's so much that keeps us from really being like, and I think you're right about the distraction, that we're just not very embodied.
Yeah, I think personally, this is why having a regular physical exercise practice is so important, because you innately are using your body. And it depends on the type of practice. But I think, for example, going to a yoga class is a great idea because it really helps you become more centered in your body. Sports is good because, when you're playing things like badminton or tennis or football or basketball, you have to be in your body because you got to move it quite quickly. So it brings you back into your body. It helps reconnect you to your body. And then, like I said, if you do it with any regularity, all of a sudden your shoulder hurts. You go, wow, I can't do that because I got to figure out why that is so I can shoot the basketball. Having researched this, I was really blown away when I found out. I learned this from a guy named Michael Mogadun, who's got a master's in public health and researched this. Only 3% of women and 8% of men worldwide do any form of regular exercise, including walking a dog.
Oh my gosh.
And I was floored by that. And I'm like, so I tell my students in class, I said, the people you see riding bicycles on the weekend and at the golf course and at the park? And they all said, yes. I said, well, what you don't realize is you're seeing everybody in your city that's actually exercising. Metaphorically. It might look like there's a lot in a city like San Diego, but there's 3 million people here. So when you see 100 bicyclists go by, remember there's 2.5 million plus people that are still not doing anything that day. So it's easy to get tricked.
I just think in general, that it's such a feedback loop and it's such a vicious cycle. People don't move their bodies. They eat in a way that doesn't support their well-being. There's so many chemicals in the environment that are just creating like so much inflammation in the body and the brain. And then a person doesn't feel well. And then they don't feel like going outside and walking, but then when they don't do that, then it makes them feel even worse. And I think in general, like people are not in a state of well-being now. Like there's so much fear in the collective and so much hopelessness about what's going on politically and environmentally. It requires quite a lot of consciousness to maintain an uplifted spirit and to do all the things that you need to do in order to promote your health and well-being.
One of the things I get from a lot of people that reach out to me is I don't know how to love myself. And I think what I've suggested to people, I suspect you'd agree with me, is I tell people that when we're in an environment like we're in, some of the most helpful things, aside from the things we've mentioned and just getting outside and getting your bare feet on the ground to ground yourself, is to have a relationship with trees, plants, and pets, because they're unconditionally loving, really. And to have some roses or some beautiful plants in your house.
I'm so with you, 100%.
Because then you're engaging in life, and life gives life. And I think also having outlets for creativity. There's a great book called The Art Spirit by Henry Miller. I think you'd find it mind-blowing. It's an amazing book. And he talks about exactly what I feel when I paint, because I have a practice of just letting my soul paint through me. And he says, doing art adds life to life. And it's so beautiful. And when the art spirit is in you, you feel that additional consciousness, that additional life force, the magic of something working through you. And so I think little things like taking your dog for a walk and playing with it, and loving your cat, or loving your plants, or pruning your trees, or, working with some stones in the backyard and putting stone circles around your trees. I teach people to stack rocks because I want to show them how to do unbound play so that they learn to have playfulness without an outcome, because we're so caught in this outcome self-evaluation. Is it good enough? Is it going to make me money? Am I pleasing other people? But a stack of rocks falls over. It's just a bunch of rocks. Just say, hallelujah, let's try it again. And so I really try to encourage people to learn how to engage in acts of love that don't have a necessary objective outcome, but it's just an act of learning to share and to feel.
I like what you're saying. I like what you're saying about creativity and how enlivening that is. I sometimes, like on my intake evaluation for patients, I ask them, what are things that you used to love to do when you were a child, and do you still do them? Because those are kind of clues to things that were really sort of basic to their authentic nature.
Yes. Having studied shamanism extensively, there's some classic questions a real shaman will ask you if you come to them for help. And I think these questions are important for everybody listening, because they really are diagnostic of where the trauma or the pain or the shift began, and you lost the authentic expression of the soul or the child spontaneity. And that is, when did you stop singing? When did you stop dancing? When did you lose your sense for the magic, mystery, and awe of life? When did you stop enjoying being alone with yourself? And there's one more that
I think it's about telling stories.
Yes, when did you stop enjoying good stories? That's correct. So those 5 questions, I think, have always been, for me as a therapist, right in the forefront of my mind when I'm doing an intake analysis and when I'm sitting with patients and trying to, really pinpoint where it is that I need to direct my therapy for a long-term resolution versus the mechanical or physical aspects that I have to work on for alleviation of pain or improving digestion, or the physical and mechanical stuff that needs to be worked on but won't ever go away if you don't get to the core issue. In closing the first segment of the podcast that's free for everybody, remember those questions. When did I stop singing? Pay close attention to what happened, because there's probably a need for healing and potential soul loss there. When did I stop dancing? When did I lose my sense of the magic, mystery, and awe of life? When did I stop enjoying being alone? And when did I stop enjoying good stories? If you look at that and identify what happened and focus some healing there, but incorporate singing, dancing, being alone, enjoying stories, and being alone, I think one of the greatest things we can do to be alone with ourselves is just give ourselves permission to not have to think about anything and just simply watch the mind. I mean, one of the most common things people ask me, how do I stop my mind? I try to meditate and I can't stop my mind. And I tell them, you don't stop a mind. That's like asking a wheel to stop rolling. Minds think. That's like asking water to not be wet. Water is wet. You watch your mind and you just let it be like a movie you're watching and say, look at this amazing show inside of me. And what happens is, once the mind realizes that you're watching it, it does something funny. It stops being so active. You just got to watch. And then all of a sudden you have moments of emptiness and you realize how amazingly blissful it is. And for that moment, you're no longer in a subject-object relationship. You're having a beautiful non-dual relationship with yourself. It's just you, and there's nothing else. But it's the real you.
I like the one that you mentioned about, like, when did you stop appreciating the magic and awe and beauty of life? Like, that's the mystery, like that really needs to be cultivated.
Yes, it does. Well, thank you for the first segment, Judy. It's been great. And I'm really grateful that you have carried your own evolution into your practice to help so many people. For those of you that are Spirit Gym podcast members, tune in to the rest of our conversation, because I have some really interesting things to talk to Judy about. And I'm sure you're going to be very interested to see what her answers are on things like myth and tarot and other things. So I'll look forward to sharing more with you there.
I hope you enjoyed the conversation between Paul and Judy Tsafrir, MD, talking about holistic psychiatry. If you found value in today's show, there's more great content waiting for you in our special brand new Spirit Gym podcast membership. When you subscribe, you'll get access to exclusive extended episodes of Spirit Gym with Paul Chek, members-only Q&A opportunities with Paul, access to the podcast members forum within the Spirit Gym community where you can interact with other passionate listeners, and the opportunity to purchase exclusive Spirit Gym merchandise. Your support helps keep the show running and allows us to bring you even better content. So if you're ready to dive deeper and unlock all these amazing extras, head over to paulchek.com/podcast and become a Spirit Gym podcast member today. You can find Judy on her website at judytsafrirmd.com. That's JUDYTSAFRIRMD.com, where you can find out more about her services and also subscribe to her blog, Adventures in Holistic Adult and Child Psychiatry. Her award-winning book, Sacred Psychiatry, Bridging the Personal and Transpersonal to Transform Health and Consciousness, is available from Amazon and all good bookstores. For more of the resources mentioned in this episode, please visit the show notes page at paulchek.com/podcast. You can also find details on the special offers from our premier sponsors, Bioptimizers, Paleo Valley, Wild Pastures, and Organifi, as well as links to Paul's social media, his YouTube channels, and his blog. And if you enjoyed today's episode, please consider leaving us a 5-star rating and a warm review on the podcast platform of your choice. This podcast is available on Apple Podcasts, Spotify, Amazon Music, Audible, and YouTube.